The CDC says Candida auris has infected more than 2,300 people across the country since the beginning of the year. 349 have been here in Florida.
The people that are at risk for this are people that are coming in and out of the hospital a lot, people that are in the long-term care facilities, just as a skilled nursing facility, a nursing home, and those kind of places.
Dr. Vinay Pelakonda is the Chief Medical Officer at HCA Florida West. He's been monitoring the spread of Candida auris and says the fungus is hard to treat.
The thing that makes this particularly troublesome is when we test for it, sometimes it'll mistake this type of Candida for another type of Candida. And there's a specific type of treatment for this particular Candida auris species because it is so resistant to a lot of the medications we use for other fungi.
Dr. Pelakonda says the best way to prevent it is to make sure healthcare workers wash their hands frequently.
We've rolled out on our badges for all of the healthcare providers. We're going to put a chip in there so that we can identify those times that we go and wash our hands, and we encourage it.
That program is called Intelligent Observation. The hospital has hand washing stations set up throughout the building that track when and how often an employee washes their hands.
So we're going to be very data driven to find out maybe pockets of folks that aren't as meticulous about washing their hands. We'll be able to target those individuals and say, let's do the hand hygiene.
So far, Dr. Pelakonda says HCA Florida West had a single case of the fungus a year ago. He says the public for now has nothing to worry about.
And I know that the public probably has watched one of my favorite shows on HBO, The Last of Us, and the fungus apocalypse. This is not a fungus apocalypse by any means, but it is something that's concerning. I know recently the CDC has put a statement out that this fungus is something to watch.
If a relative staying in a long-term care facility says they might have a fungal infection, Dr. Pelakonda says that the facility will more than likely be testing for this type of fungus just as a precaution. In the studio, Brent Carney, WEAR News.